Okay, so our next speaker is Swapna Kakani. She's an advocate in the area of rare disease, healthcare delivery, and the patient experience. Swapna has given several presentations across the U.S. through medical conferences, hospitals, medical schools, graduation ceremonies, and corporate events, including a TEDx talk. Swapna, in addition, does healthcare advocacy work both at the federal and state level for the short bowel syndrome, intestinal failure, and broader rare disease community. She received her master's in public health in 2020 from UAB. She's also the founder and executive director of Alabama Rare, which is a grassroots organization to unite Alabama around the rare disease population. It acts to bring support for individuals and families, educate the broader community, and bring awareness to the population's needs as they advocate for necessary change to improve healthcare delivery. It aims to celebrate what we have in our backyard and collaborate with stakeholders to move rare disease diagnostics, policy, and patient experience forward. Her passion is to share her experiences and serve others with chronic illnesses. As you listen to Swapna's story, you will be challenged to rise above life's adversities, live life to the fullest, and achieve your greatest goals despite the circumstances. A few years ago, I had the privilege of stumbling across a tweet that caught my eye from Alabama Rare. It was promoting an advocacy day they were holding the following week in Montgomery. And I responded that I would like to attend and advocate for adding spinal muscular atrophy to the Alabama newborn screening panel. Swapna responded and said, "Sure, please join us and we will support you." And she did. She had handouts for us. She had them for the legislators. She had appointments set up with the key officers and helped spread the word. From that day forward, I've kept Swapna in my small circle of favorite people in the state, and we continue to join together, sometimes at the very last minute, sometimes in advance, to advocate for people with disabilities. Thank you for joining our group today. Please welcome Swapna Kakani.
Thank you, Linda. That was a very nice introduction, and you're right. Sometimes we're very prepared, but sometimes not. But that's the famous phrase in advocacy. It's hurry up and wait. So a lot of times you do a lot, and then you just have to wait for the other parties and stakeholders.
Okay, help me put this on presenter mode. I'm not
that's
familiar with Google Docs.
I don't know, because it says you have to download it into a PowerPoint. I mean, I can share from my computer. I don't mind.
Okay.
Okay. Okay, so hi everyone. As Linda said, my name is Swapna Kakani, and I'm the founder and director of Alabama Rare, and I have my own speaking and healthcare advocacy platform called Swapna Speaks. I am here today to talk a little bit about how to identify strategies for beginning and sustaining grassroots organizing around specific issues. So I haven't designated any specific issue as I was going through this presentation, but that's where I wanted you to chime in as we go through. I want to ask the group, what are some specific issues you have been wanting to advocate for or organize around, and we'll get into that. So first I'm going to share my story because it leads into grassroots organizing. So I was born with a rare disease, a congenital defect of the small intestine called intestinal atresia. So I wasn't born with all my small intestine. And subsequently, I was diagnosed with the rare GI disease called short bowel syndrome. I got all my pediatric care just at Children's of Alabama in Birmingham, which at the time felt very far because I'm born and raised in Huntsville, Alabama, where my family is. So driving those 2 hours or being away from the rest of my family as a patient at Children's felt like a lot. But now as an adult and the necessity for subspecialty care, I understand that 2 hours is really not that much. We're very fortunate to have Children's and UAB in our backyard. Well, being born with short bowel syndrome, so what does that mean? So short bowel syndrome means that you cannot absorb the adequate amount going into adequate nutrients that you eat or drink to live. And that can either happen because you do not have all the gut, so anatomically you do not have all your intestine. It also can happen when you may have your intestine, but it physiologically, like mechanically, it doesn't work. So from day 2 of life, I have been dependent on nutrition from an IV in my chest, receiving TPN, and this is examples of TPN, me mixing it and hooking up. In addition, I received a tube feeding that went straight into my stomach, and I wore that backpack every day for 16 hours of the day, or 8 hours of the day, 8 hours a night. And the TPN that you see in this middle picture, I received that anywhere from 3 nights a week to 7 nights a week for 12 hours at night. So 6 p.m. I would have to hook up, and then 6 a.m. I would unhook, and then I would go to school with the tube feeding backpack on your left, wear that for 8 hours, and then come home, take a little break, and then hook up again to the TPN that you see in the middle. And that would be my routine. What about eating? I ate for taste, really. Most, if not all, my calories came from these 2 sources of nutrition. And however, the goal was to try to push myself to eat more by mouth. And it was hard due to the anatomy and physiology of my gut. So I went to school with 2 backpacks, I say, my nutritional backpack and my academic backpack, and went to school really similarly to my peers, kindergarten through 12th at a private school, and then went to college at UAB, again, moving on with my backpack and supplies and medicines. Well, in college, my disease and my symptoms got very complicated. We had to fight to find subspecialists. My family and I, like many with rare diseases, have to put my health in our own hands. And we Googled doctors. We traveled all across the country trying to find subspecialists because my case was getting very complicated and I was having serious complications. It came to the point where I made the difficult decision to remove the small intestine that I fought every day of my life to keep, and unfortunately I had to have surgery to remove it. And then after that, I had a small intestine organ transplant, now almost 8 years ago, 12 hours away from home in Ohio. Before the transplant, I had to stop eating. Even though I just ate for taste, I still could eat. But before the transplant, due to the complications, I had to stop eating by mouth completely. And I could only chew or spit out. And then all my nutrients came from the IV, those pictures that you saw. And my G-tube, my feeding tube, was no longer being used. Instead, it was put to drainage. So I was losing a lot from my GI tract, and I always would have to just replenish through IVs and then chew and spit out if I was hungry. At the same time, I said, I have to finish college before I have a solid organ transplant. And heaven forbid, if anything were to happen, I want to know that I graduated from college. So I went back to college connected to an IV backpack 24/7, drainage bags underneath my clothes. And then once I graduated, I decided to have the transplant. And this is about 30 days after the transplant, about 3 weeks after the transplant, I get to eat and chew and swallow solid food again. And I'm having my parents' homemade Indian food. So in my lifetime, in 32 years, I've had 66 surgeries. That includes abdominal surgeries as well as IV line placements and hip replacements and all kinds of other things. And in those 66 surgeries, what I've learned is to really appreciate the big picture, like how far I have come in living with a rare disease, but persevering alongside the challenges, but also the highs of having short bowel syndrome. So on the far or top left, you'll see my first picture when I was born. I was tiny, 4 pounds and 4 ounces. And then you'll see different pictures that represent big milestones in my life, giving the TED Talk. The top right is being discharged from the hospital after the transplant. And if you may notice, I'm not connected to any backpack, connected to any IV or tube for the first time in years. I was able to have a break. When I graduated from college, 6 months before the transplant, I was given the opportunity to give the commencement address. And then the bottom right is I traveled to Seattle, farthest I've ever traveled by myself, and I'm eating for the first time just freely with no pain before, during, or after, which I never had experienced that before. So the big picture and 66 surgeries have taught me what I say simple truths, and I think individuals with disabilities and rare diseases and chronic diseases have come to similar conclusions, is really appreciating how far I have come or how far we have come in our own journey. And then what I can do, not what I can't do. I try not to focus on the things that I have limitations on, but more so what I can do. And there's plenty. But what I can do with the energy and time I do have. I don't have the same energy probably as my peer who's 32 years old with no disease or disability. And I probably need more time to rest. However, I still have energy and time to make an impact. So what am I going to do with it? After it was really the transplant that really enlightened me into what may be my purpose. I got medical care 12 hours away from Alabama at what was supposed to be one of the best hospitals in the world. And from the get-go, I felt like my voice was not heard. I was fighting to be treated like a human, but also be treated as part of the team. Had been doing this routine for 20-something years at that point. And I learned that healthcare is run by humans. And if we can treat each other like human to human and have very authentic, empathetic conversations and teach each other where the other one is coming from, maybe we can move healthcare a little more forward. So it became my purpose to share my own story as it relates to healthcare delivery, patient experience, and what I have learned in interactions in the healthcare system as it can relate and help to improve healthcare for clinicians as well as my own peers. So these are some examples since the transplants in the last 8 years where I have given talks, keynotes about, you'll see on the bottom, if you're familiar with central lines to receive IV nutrition, CLABSI is a central line infection and one of the biggest metrics hospitals look at. So giving that presentation, the middle one is giving a keynote at a patient experience conference and so forth. But then what I learned in doing that is a lot of things that I wanted to see changed in the healthcare field or in the hospital or even with an insurance provider or even day in and day out of living with tube feedings and TPN and coverage and even meeting my peers who are having trouble getting coverage on certain things. If I tracked the cause, kept on going back, it came down to policy. Healthcare policy. So I then devoted a lot of my time to figuring out, well, how can we change healthcare policy, both at the state and the federal level? So I really mark the transplant as the inspiration. It was really the cherry on top of the entire journey that then got or influenced me to do more political advocacy and grassroots organizing. And so this picture, the second one from the right, is standing outside Representative Brooks' office in the federal on Capitol Hill, and then of course standing outside Capitol Hill. I just finished a fellowship with one of the national organizations for one of the national rare disease organizations, building a grassroots state advocacy program for them. So, as I said, this is about strategy for grassroots organizing for building and maintaining. So the number one strategy I'm going to tell you today is identify the need or issue. And then I also paired that with ask questions and like, how can I help? I say both of these because sometimes you don't know the need or issue. For me, I had no idea what the need or issue was. I just knew there were problems, and I had peers that were not getting their medications covered, and I saw things in the hospital that were not being done due to policy, but I didn't really know what the exact issue or need was. So I want others to speak up if you don't mind talking, and just one or two share what is a need or issue that you care a lot about, or maybe you've learned in this program thus far that you want to address or try to approach in some way. You can even put it in the chat, and I can look at it as we keep on going.
And please remember to state your name when you talk, so everybody can see.
Hi, this is Veronica McGee. Can everybody see you? Hi. Wow, what stories are so powerful. My son was also born with a very rare, two very rare diseases. He's 22, but he was born, one of them is called aqueductal stenosis, which is a form of, a very serious form of hydrocephalus. He was very, very sick for many years. He also has a rare genetic mutation called L1CAM, which is also very extremely rare. And he is been very healthy most of his life. He's a power chair driver, and he doesn't use words to speak, but he is he has had a pretty good healthcare journey. We have been fortunate, unlike compared to many other adults like him with rare diseases. He has not gone through the grueling challenges of many surgeries like yourself has, and many other adults like him and young people like him who have his type of diagnoses. But I also worked for a large infusion company for many years and sold, quote unquote, TPN. It was a very, very financially driven service. And I definitely can relate to hearing the stories of how so many of my patients that I served through the different physicians' offices and hospitals that I was responsible for helping, not being able to get this TPN covered. And you're right, it's a very, very costly treatment. And it was a hard thing to watch people get denied. So I definitely can relate to that in many different ways. Kyle's healthcare needs is not my specific advocacy for him right now. Our advocacy has been super hyper focused in the last 3 or 4 years on creating communities that are inclusive, affordable, accessible for him to live when many aging parents, are not able to take care of their adult children at
No,
home.
that's
So,
important. Yeah.
so we're doing a lot of work in that area in the state of Alabama. We have some very strong strategic partners that are aligning us, but this has been so good for me to see you just make it, you can just get so caught up in the so many different, what is the true need and how do I get to that point? So just identifying the need and the issue and then, asking the questions, just reminds me that you really, really have to focus on specifics and having your story be told and creating that story like you just did, because that is so powerful. So I am very excited to have had this opportunity. This is just very good. And I have a strategic partner that's based in San Francisco, California, who has been able to take this issue of affordable, accessible, and inclusive housing and do what and make it understandable and help and realize that you can't change this crisis 10 units or 100 units at a time. We need to have a policy change and a cultural shift to help our policymakers and our funding sources understand that this needs to be done because it's a basic human right for everyone to have a dignified place to live that's inclusive and affordable.
Yeah, no, great points, Veronica. And I think you segue really well. And thank you for sharing. And I'm happy to hear that there's someone else that can relate to TPN, but also don't want other people to have to go through TPN. But it is a lifesaver when you need it. And very much props to you as a mother and to your son. But you brought up a great mindset that I wanted to cover. Is that one is it sounds like you knew the general issue, and then as you engaged with partners and got more deep into it, asked the questions and shared your story, that need and issue may become more clear, and there's clarity to it. So you may don't fret that you may not know that right now, but you may know the gist, or you may know an idea, or you want to pair with somebody else, or you want to just follow another organization and advocate for what their needs and issues are. That's totally fine. The main point is to be engaged, ask questions, because at the end, when we get to closer to the end of taking action, we will want to get more specific. So strategy number 2, work with what you have. So I'm going to share a story. So as I said, I had no idea what the need or issue is specifically, but I had that emotion inside of me. I was frustrated. I had been living in the healthcare system for, at that point, 24 years after when I had the transplant. I was frustrated how I was treated, was meeting different people with different coverage issues, but I didn't really know anything specific. I had gotten my undergrad degree and was trying to recover from the transplant, but I knew I wanted to do something. Well, the National Organization for Rare Disorders hosted a one-day meeting on a Saturday in Atlanta for short bowel syndrome. They don't do that anymore. They used to host disease-specific meetings. They don't do that anymore. As you can imagine, there's a lot of rare diseases. For some reason, I had this gut instinct, pun intended, to go to Atlanta and meet Nord. I knew, I think this is a contact I need to have and need to know. So I went, and they said, hey, we're just starting these state advocacy events, meaning we want to advocate at the state house with our state legislators in every state, and we have a volunteer doing it for Alabama. Would you like to help? And my eyes got big. I was like, I didn't come to Atlanta to do that. But again, I said, okay, how can I help? Because I was trying to get involved. I was trying to network. I was trying to get started. I was 24 and didn't really know what to do next in my life after having graduated, did the transplant. Now what? So I said, yes, how can I help? I'd love to get involved. Well, I have never been to, at that point, I had never been to the Capitol in Montgomery, the State House. I'd never been to the Capitol Hill in DC. I was really blind. So, but I know the next strategy is work with what you have. I know Facebook, I know social media, I can send an email, I can create an agenda. I can try to start spreading the word. And NORD also had some tools to help, but we as advocates really ran with it. So this is the first Alabama Rare Disease Day that we ever hosted. And this is all just made from my own printer and computer at home. And we had been taught that you should leave take-home packets for any legislators that come by. And then we were actually unique. We were the only state who had this idea to do these little profiles where you'll see a person's name, picture, and then it says where they are from in Alabama, where their district is, because state legislators, we were trying to think, okay, if we're in the brain of a state legislator, what do they care about? They care about who is their constituent. Of all these papers, who is their constituent? Then I said, I don't have the time and space to put everybody's full story. Instead, let's bullet them and say, what are the challenges you have by living in Alabama, by living with your rare disease in Alabama? So some people said, like Veronica that you mentioned, some people said, my medical nutrition is not covered. So my tube feeding the formula is not being covered. I have to pay for it out of pocket. I mean, so there's some incredible stories. Or some people said coordination of care, or I have to go 12 hours, like myself, I have to drive 12 hours to get to my doctor. And there's no kind of reimbursement or support financially. This is all coming out of pocket. For the first time, people had a voice to these legislators. Now, you'll see on the left, this is our first time. I didn't know anything about the State House. I didn't know that there were days where you have legislative sessions where they're voting and they're on the floor versus days where they're in committees. I didn't know when you're supposed to host some of these advocacy days to get the most attendance by legislators. So we only had 2 legislators come, and this is the group in the bottom left. And I had never met any one person in that group before. This is all through the power of social media, sharing, having a registration link, and people having faith that, hey, this is something that's necessary. We need to have a voice with our state leaders. Well, it turns out this lady on the right here is on the health committee and has now sponsored 2 of our bills. I didn't know that when she picked up that folder. I just saw another person. But she has been a huge champion for us. So the next strategy, which I'll bring up, is learn from the past. So I said, I can't walk away from these individuals. We have something here. What can we do as a group? We are now a grassroots coalition. I created a Facebook page called Alabama Rare, because that's what we were. And then we did better the next year. I got a proclamation from the governor to name Rare Disease Day, February 28th. And then, so that got traction. We got more people to submit profiles. We had more legislators. We had an open house. I understood when to do it, where to do it. Don't do it in a meeting room. Do it in an open hallway where everybody's walking around. Put somebody in the elevator because they can ride the elevator and talk to legislators. We got a lot more engagement. I may have already said one of these strategies. Yeah, so I learned from the past and improved in the next year or the next venture, next partnership, etc. So then this is our 3rd year where we met with Speaker Mac McCutcheon. So if you know that name, he's the Speaker of the House. This is the year that I think, Linda, that you came. where we had, no, Linda, you came in another year. That picture's coming. But where I learned to meet with the leadership from both the House and the Senate side. We partnered with UAB and Children's of Alabama to host the first ever rare disease educational symposium. Governor Bentley signed a law that says February 28th is Rare Disease Day in this state from here on out, and February is Rare Disease Awareness Month from here on out. So what does that mean? I mean, it is an awareness bill, but what it did for the community is it showed the community, and what I wanted it to show the community is that you're not alone. You're not alone at all. And there are individuals, only some are featured here, but there's a whole network of people fighting to bring awareness for rare disease. And the time is not now to feel alone. We can do better than that. So we are here for you. And so we circulated this picture around, again, so power of social media. And in this picture, you'll see researchers, an MD, PhD, a patient, a senator, and a researcher, a caregiver, purposely put together as many different types of people that affect the rare disease and are affected by the rare disease community. So by that, doing those state advocacy events, NORD called me and invited me to come to their office and spend the summer there. And it was a huge honor to live and work in DC. And so I got to really learn from the federal side. So I got to go to Capitol Hill for the first time and advocate for federal bills that also affect the rare disease community, like the orphan drug tax credit or the medical nutrition equity bill. But when I was in DC, so the next strategy, I hope you can see the screen. The next strategy is, there we go. Connecting to national organizations as it relates to your disability, your disease. And I think you're doing that in some aspect with this program already. So some of them, at least in the rare disease space, is the Every Life Foundation for Rare Diseases, NORD, Global Genes. Those are some of the bigger names. You may recognize the guy in the center. That's Senator Shelby, our senior most senator, who is retiring this election year. We ran into him in the hallway during an Every Life Foundation for Rare Diseases event. So every year, Every Life Foundation hosts Rare Disease Week on Capitol Hill, and they fund advocates like ourselves to go to DC and have meetings with our legislators. And we were just walking around and we saw Senator Shelby. He's not the best at selfies, he will admit that, but that's his smile. That's a smile from Senator Shelby. This is our group from Alabama that went. And when I say connect to national organizations, because they have resources that you just may not know about, and then also contacts. And you never know when you can use them and they can use you, and vice versa, and help one another. But when I was in DC, what I realized is where I live really matters in the type of care I receive, the quality of care I receive, the access to resources I have. So I would sit in the representative's office in DC and speak about the importance of medical nutrition coverage, and I would share the stories from my peers in Alabama. I had them text me their stories, and I put them in a Word document and gave it to the representative. But I just kept on sitting there and said, what are we doing for ourselves in Alabama? The one thing between federal and state, as you may have learned already, is it's very hard to pass a bill at the federal level, and it will take much longer time. And in some respects, sometimes a bill can get passed and is maybe more apt to be passed at the state level than at the federal level. But there's a lot to do at the state politics, and it's very important because our day in and day out lives really are affected by state policies. So I said I have to come back to Alabama and engage in grassroots advocacy. So I want to just remind you what the impact of grassroots advocacy is. I feel like Liz may have talked a little bit about this, seeing some of the last part of her presentation. But I want to remind you that you yourself have the power to affect change. And this is why I'm giving this presentation, to say that it only starts with one person. And I wish people were told me this at the beginning, that you are the only one who knows your story the best. And so thus you are your greatest advocate. Yes, your loved ones can speak for you, and technically your legislators should be your advocate as well. But the truth is, you know your story best. And so you are the advocate, and be proud of that. A lot of grassroots advocacy is not, I think people maybe think it's really fancy and you need a degree for it, or it's a lot, but what it is education. Education. You're explaining to others, just like I am today, what is short bowel syndrome? What is the nutrition that we're on? How does it get covered if it is covered, or how it is not covered? You know that better than anyone else because you live with it every single day. So don't feel afraid to be that educator, the trainer, the resource. So I would go into offices and literally I printed a picture of my backpack that you saw on that slide, the far left backpack, my tube feeding backpack, so they could see the picture, or I even had it on me so that I had the full live prop for them to see. And they love to see the picture. They love to keep a picture because it reminds them who you are and also reminds them why they're in that position. Every effort to advocate matters. And I say that because also you don't have to be the front person, the person on stage. I've had advocates ask me, well, what can I do behind the scenes? That's as important as someone who wants to be the speaker. Promise me, there's always administrative tasks, there's printing out, there's creation of materials, there's so much to do behind the scenes that if you are that person, we welcome you in any organization, grassroots effort, anything. And then remember that you are their constituent. I mean, they are elected to take care of you, to hear you. And always say that. If you ever meet them, always say, I am your constituent. And you are the expert. Remember, you're the expert of your own needs. So when I came back and I realized, well, where I live really matters, we cannot be silent. And up until that point, I felt like I was silent. And up until my 20s, I wasn't really doing anything about it. I had no idea. And I said, no, we can't be silent anymore. We have to speak up for what we need. So that is how Alabama Rare was born. So it started with that small group that came to Montgomery. I started a Facebook page just called Alabama Rare, and then it grew from there. And we continued to persevere and host events and expanded those events over time. And it's based on this concept of where you live really matters, and it can play a role in policy. So we are an organization to unite the state around the rare disease community, and we truly work with what we do have. And what that means is working with the network that we have, but also the entities in our state that we have, and we collaborate together to affect change. But why? Why would we do this? Why is grassroots organizing, from the standpoint of Alabama Rare or any other way, so important? Well, one, there's a power in numbers. Truly, there's a power in numbers. You may see this on the news when offices are getting called nonstop. That's an impact because they see a large amount of people care about them one way or another.
Oh, yes, ma'am.
In rare disease, and you may see this in disability, different diseases that cause disability, is that our causes, our etiologies as to how we got the disease or the disability are different. But a lot of times the experiences that we live day in and day out are the same. That speaks volumes. And there was no organization or grassroots coalition focused just on the rare disease group in the state. And then there wasn't anybody to unite the stakeholders and be that lead. So here are some events and advocacy initiatives that we've expanded from that one state. I started with the state advocacy event, and then we did the rare disease symposium, which we do with UAB and Children's, and then now we've expanded. But more than that, I want to go to next strategy. which is meet the community where they are. So let's say now you have an idea or a need or even a desire to host something for the community. Well, where do you find the community? Like myself, I didn't know at first, but I used social media. I posted about the event. I even would Google news stories and rare disease, or AL.com rare disease, and see what stories came up. And if possible, I would contact those families. I did hashtag rare disease, hashtag Alabama rare, all the hashtags you can think of that could relate to Alabama and rare disease. And thankfully, because we have national organizations, they also already have some hashtags. So that was a good start. And slowly this Facebook group started growing, and we have started a community. And then as I partnered with more entities that are bigger than Alabama Rare, and people came to those events because they knew the other entity, they then got introduced to Alabama Rare. Or there's Linda, who saw our tweet and came, and thankfully was impressed, and we've been in contacts ever since. You just never know when people will find you, but you also never know when people will be helped by what you're doing. So keep on finding that community. This process never really stops. This is the part of the perseverance of constantly engaging. So next is, okay, so you're meeting the community, but what about partners? So you do outreach to partners. And it's a little bit of the same concept. Partners can include, like for Alabama Rare, it's UAB, Children's of Alabama, USA, Alabama Department of Public Health. So we distinguish our partners based on what our objectives are. For that rare disease educational symposium, we outreach to UAB. So actually I was going to UAB to meet with the chair for a different reason, to pass a policy. And then I found out about this symposium, and they needed the patient family part of it. So we became that partner for them. But with Alabama Department of Public Health, that's purely a policy. Like, we want to change some policies as it relates to diagnosis for the rare disease population in the state. So I have been just going through different contacts at Alabama Department of Public Health and meeting different people, emailing, but keeping up with contact and emailing them regularly. Then I find out about committee meetings that you can attend. And I mean, it's nonstop. Once you reach out to different people, you'll find other ways to engage more officially. Or you may even form an official partnership. But just keep the engagement open, keep your mind open to the possibilities of how you can outreach as well as partner. So who do you engage when you outreach? And so that can involve really anyone. Program directors. So for example, we're working on newborn screening, and newborn screening is run through the Alabama Department of Public Health. So we're working with the program director, we're working with the lab director, the chief medical officer. We're also working with governmental affairs. Those are, if you're in policy, governmental affairs is a common department to talk to, because they're involved in legislation. So again, all stakeholders that could be involved in a legislation, if you're going in that route, that pertains to state and federal. Your governor, and also their staff. Staffers are as important as the actual legislator, even more so, especially at the federal level. At the federal level, every legislator has a staff or multiple staff members. The staff are the ones who are going to meet with you and summarize what you're saying and give it back to the legislator. And don't feel gypped if you're going to meet with a staff member. They are very important. Give them your time. That is a relationship you will be making for the long run. Government agencies. So here in the state, we work with Medicaid. But the same goes with the federal level. Sometimes you may have to engage with FDA, Department of Transportation. It all just depends. Committees. So in both of the federal and the state level, when policy moves, I don't know if you learned how a bill becomes law and in the School of Rock song, but they do go through committees, and those committees have chairs and specific legislators on them. So sometimes, and of course, and their staff. So sometimes you need to engage with them at the appropriate time. So when do you do this? Always keep engaging with the partners and your designated stakeholders. Always try to be vocal early. So for example, we're trying to hopefully maybe make some change in newborn screening in 2023. So we're laying the groundwork right now. These build a lot of what we do when we engage is the process of building relationships. It's okay if you didn't go from A to B in that one meeting, but more so you created a relationship. And as you meet more, you build that relationship further. And that's really probably the most important thing you can do. And it's the foundation of any partnership. You can do it in preparation and creating a bill, or in preparation of the bill almost passing. If you have a bill that you care about, you should time it into when the bill's progressing. So for example, if it's almost to the floor ready to vote, that is a very important time to engage. And that's maybe when you see on TV where a lot of people are calling senators' offices and representatives' offices. Another way to outreach is to sign on to a letter. So what that means is a lot of times policies or bills have coalitions, and we together as a coalition, which is a group of organizations, we all sign on a letter saying we support this. That's a great way to get involved. And then, or let's say there's a new development on your side, or from your organization side, or from your efforts update, and you want to let them know. That's a great time to outreach. And sometimes it's just to say, hi, I want to introduce myself. You can do that. That again, because the idea of this is building relationships. So with those 6 strategies, I believe now, we have grown Alabama Rare to what we are today, where we are now, I think this is our 4th, we just hosted our 4th symposium with UAB and Children's of Alabama. And we passed a Rare Disease Advisory Council bill with Governor Bentley right before he left office. We passed the Rare Disease Day resolution, naming Rare Disease Day in the state with Governor Ivey. And then this is our last in-person State House Advocacy Day before the pandemic. So I wanted to just briefly, I think this also has been covered, so I won't go into it too much, but let's say you do have the meeting or you do outreach to a partner, what are you asking? And so always ask yourself, what is your goal? And again, the goal can be, I just want to introduce myself, but explain who you are and who you represent and why this is important to you. What is the problem? What is the solution? So if you can imagine, the person on the other side is going to get a lot of requests and probably has a lot of meetings and has a lot of things on their mind. So for you, if you can be concise and very thorough in your explanations of why you're sitting there and why you want to meet with them and what your ask is, the better off you will be. Follow-up is as important as having that meeting. Again, because there's always so much that is going on in their lives. You can be lost. After that one meeting, you'll be lost. So make sure you email and you follow up, and you, if you have leave behind material, even better. And then I guess I'm getting lost in my own strategies, but research your resources. So what does that mean? I'm not necessarily saying Google everyone. What I'm saying is learn about the topic. There is a lot of information on just like Veronica said, inclusive community. There's information on that online. Maybe other states have done something that you appreciate, or states have done something that we don't want to replicate. There's a lot of information on newborn screening and what other states are doing. There's policy papers. I mean, take the time to do that research. It does matter. You may get questions on it. And if you get a question, it's really okay. I encourage you to say, I do not know, but I will follow up. And you can pass along this research. And so these are all the strategies I listed. And the truth is, you repeat them. You do them and you repeat them. And they don't necessarily always go in this perfect circle, but they are all very important. This is us passing the Rare Disease Day. February 28th is Rare Disease Day from here on out. And February is Rare Disease Awareness Month. And then I'm going to end on this note that I like from Senator Doug Jones when I met him at a healthcare policy workshop, actually in Birmingham. And when I said who I was, and I said, I'm your constituent, and all he said was, keep up the advocacy, never, ever, ever stop. And I thought it was a perfect phrase because it's very true. It's very true. It's a privilege, I think, to be an advocate, to have the health and life, to care and to care about it, but also to have the energy and time to do it. And I think a lot of our own lives, but also the next generation's lives, are dependent on our ability to advocate. But with that, I want to just give you some takeaways that I didn't focus on too much in the presentation, but I think are implied in some of what I said. And one is really be clear in what you are advocating for. Again, you may not know that at the beginning. That's okay. That's why you ask questions, you engage, you partner with others, you go to their lobby days if you want, you learn. I call it ship it rather than waiting to be perfect, meaning send that email. The email does not need to be perfectly written. And I mean, yes, it needs to have good English if possible, but don't fret over it. And then 3 weeks later, it hasn't been sent to the leader or the person you want to meet with. It's better to say, hi, I'd like to meet with you about this. Here are the times and days that I'm available. Again, there's a role for every advocate. Everyone has a role, and every role is important. This is all about creating relationships for the long term. And then it's not about what party you belong to. It's really about your story and your need or your community's need. Call, email, meet with your leaders. You meet, that means virtual as well. And always say thank you. Again, it's human to human interaction. Sometimes you may even know them from your personal life, especially state legislators. They may live down the street or own a business that you go to. And this last one I wanted to also harp on, just like Senator Doug Jones said, never stop advocating. I don't want you to define success as a win. So one, I want you to figure out, as you start your advocacy journey, figure out what success means to you. But if you define success as passing a policy or getting to that finish line of building the inclusive community, if I can use that example, you may feel defeated more than you feel like a winner. Advocacy is the definition or the soul of persistence and perseverance. And sometimes you may not get wins all the time, or what you perceive as wins. But so I have defined success personally in my own advocacy journey as being able to, just even move forward. And I think every effort is a success. The meetings we had earlier this week with Alabama Department of Public Health. There was just a foundation. It didn't confirm anything either way. But don't always think of the success as that final win. Give yourself grace, and there's definitely a lot of successes in between. So with that, thank you. And I think there's just like, ooh, no, I went over by 1 minute. So I don't know if there's time for questions.
I had a real quick question, if it's okay.
Yeah, I think
Yeah,
so.
real quick, go ahead.
Okay. I have what's called a skin condition called ichthyosis. I have one of several forms of it, but I was just wondering, is that part of the rare disease? Because they consider it a rare condition. So I was just curious.
Maybe, I don't know that specific condition. I mean, there's a lot of, so a rare disease is a disease that affects less than 200,000. So it can be, you could go to NORD's website, rarediseases.org, and see if it's listed, but that also doesn't mean that they have the entire database.
Right.
But you can see if they're thinking that the incidence is pretty low, then it most likely is rare.
Okay. Thank you.
Mm-hmm.
Thank you, Swapna, for sharing everything. And it was a great presentation.
Yeah, thank you for having me. Nice to meet all of you.